Hi, this is Dr. Vermilyea again. You may have seen the introduction to Cognitive Behavior Therapy Associates. Again, we're located here in Woburn, Massachusetts, and all our professionals are licensed psychologists or social workers. One of the things that I wanted to just talk about in this first video blog is obsessive compulsive disorder. We're listed with the International Obsessive Compulsive Disorder Foundation, which is a great resource for people with OCD. Their website is www.iocdf.org, and they're also affiliated with the OCD Foundation of Greater Boston. There are several treatment centers here in the Boston area, all of which provide excellent OCD care. One point that I'd like to make about OCD is that OCD is best treated by exposure and response prevention or by medication, with both being probably having combined treatment gains that are separate or better than either alone. A lot of people ask about what OCD is, and OCD is not just somebody who occasionally thinks about things that are troublesome to them or has, worries. Worrying is a lot different than OCD. OCD is when people have repetitive thoughts that intrude into their mind that cause them great anxiety. The thoughts don't make sense, and that's the difference between thoughts of OCD and thoughts that characterize worry or panic attacks or phobias or something like that, which we'll discuss in other blogs. So OCD, in one sense, has thoughts that come into your mind. They're very disturbing to the person. And the reason for this is that OCD often strikes at the very things that people are most concerned about. So for instance, someone who is a very well-mannered person might have intrusive thoughts of vile words. Someone who's very clean and meticulous might have thoughts that their hands or something else is dirty and that they need to wash them. In that instance, the washing would be called a compulsion. So this brings up an interesting thing. There are really two major subtypes of OCD, if you will. The first is people that have obsessions, which are the disturbing thoughts, and don't do anything that you could observe to make that anxiety go away. What's happening is that when they have the disturbing thought, let's say as an example, a young man has a thought that he has doubts about his sexuality when he looks at people who are of the same sex, and this might be very disturbing to him. And if he knows that he is straight and he's having thoughts about being gay, that's very anxiety-provoking. Now, if you were to examine or look at his behavior, you might not see him do anything. He's not going to tap his fingers on a desk or do something to make that anxiety go away. But in his head, he might be required to do a number of different kinds of rituals in terms of thinking other things like prayers or having to think about women or something to undo that irrational thought. And again, this young man in our example is not gay. He's just having thoughts or fears that he is. Okay? Another example of a quote-unquote pure obsessional thought would be having a thought that you might harm your family. And this, again, thoughts of harm are not unusual. And these are not people that are interested in harming anyone and have no history of ever having done so. That's what makes the thoughts scary, is the fact that they are not rational. They're not something that the person would ever think about ordinarily. And really, if you look at it, that's what maintains these thoughts, is the fact that they really don't make sense and attack some of the very things that the person holds dearly in terms of their kind of mores, if you will. So let's move on now to another type of OCD, and that's where someone would have a thought, and that thought, let's use the example of someone who has a thought that their hands are dirty because of germs, or that they've touched something that's dirty. That thought generates anxiety, and in this particular type of OCD, the person does something that you could observe if you were able to do that, to make that anxiety go away. And some of the things that people do are washing their hands. They might check things to make sure that they're okay, even though, again, they know that they are. And this is the hallmark of OCD. Again, they call it the doubting disease. And even though you know that you lock the house, you might feel like, again, the emphasis is on feeling that you have to go back and check, and that if you don't go back and check, that you're going to be so anxious that it's just not worth it to not do it. So the person generally goes back and checks, but going back to check, even though it seems logical at the time, because it seems like this is something that's not hard to do, it won't take very long, ultimately leads to repetitive checking, because the OCD will start telling the person in some respects that, gee, maybe you didn't check it good enough, okay, or maybe you really didn't turn the handle well enough to see whether or not it was unlocked. The person thinks again, well, I'm very anxious about this. Easiest to go back and just kind of check again. So, OCD can lead to a broad variety of different checking, counting, cleaning, all kinds of rituals that people engage in. And these are, again, not the pure obsessional types where you wouldn't be able to see anything that the person's doing. Everything is happening in their head, so to speak. Here you've got actual compulsive behaviors which the person is feeling like they're required to do in order to reduce the anxiety. We'll talk more about treatments for OCD in the next blog.